So Dr. Zires, do you enjoy being a dermatologist?
I love being a dermatologist. It was always my dream to save people's lives.
Yeah, that's interesting because you say lifesaver, but what I think of a dermatologist, it must take an awfully big zit to kill a man.
What kind of a thing what are you talking about?
I mean, you call yourself a doctor, but I would think you're more of like a pimple popper MD.
I can't put...
Dr. Zires, thank you for saving my life.
Oh, that's no problem.
Wait, how did he save your life?
I had skin cancer.
Skin cancer. Forgot about that.
So, this may not be every day in a dermatologist's life, but I've saved a life or two. Skin cancer is a real issue, and that's what we're going to talk about a little this week on Skin with Dr. Zires. So, really, what do we talk about whenever we say skin cancer? Skin cancer really has 3 different types. There's one type that is the life-threatening skin cancer called melanoma. Melanoma is a cancer just like breast cancer or lung cancer that really can kill people. That's the one we really worry about. Fortunately, melanoma is pretty rare. The other 2 types of skin cancer are called basal cell skin cancer, or basal, and squamous cell skin cancer, or squamous. Now those 2 are really common, so they're probably the 2 most common cancers there are, period, in the whole world. But it is extremely rare that either of those actually kills anybody. Just about unheard of. They are not what I would call real cancer, like lung cancer or breast cancer or colon cancer. So those 2 are not nearly as dangerous or as worrisome as melanoma. Now, melanoma, of course, looks a lot different from those 2 as well. So almost all melanomas are a really dark color. They look like a black spot or a blue spot on somebody's skin. They look very different from a normal mole, but most people who get, well, I don't want to say most people, lots of people who get melanomas have a lot of moles just normally as part of who they are, and those moles tell us that they have an increased risk for melanoma, not necessarily that they're going to get a melanoma. But so the main thing I want you to take away this week is dark black spots or blue spots that really look different from the other spots on your skin, that should get you worried, and you should either get in to see a dermatologist, get in to see your primary care doctor, get in to see somebody to take a look at that black spot or blue spot. The other types of skin cancer, the basal cell and the squamous cell, we'll talk more about those next week, but not nearly as big of a worry as the melanoma. So thanks for watching this week, and stay safe.